Om Swastiastu. Hello everyone. Today in this occasion, we from SGD B4 will present about our student project entitled Micromineral in CAD. Introduce myself. My name is Ari Gunata with 3 digit of my student ID is 096. I will tell you guys about this background of the study. So, coronary artery disease, or we commonly known as CAD, is the foremost single cause of mortality and disabilities, with nearly 7 million deaths annually. This disease is usually found in low and middle income countries, and it is a multifactorial condition influenced by various factors like uh, various genetic, environmental, and lifestyle factors. Researchers nowadays have paid more attention in the role of microminerals in this disease because apparently some microminerals such as zinc, copper, iron, selenium, and manganese play a role in this disease in terms of development and the progression of this disease. The next part will be presented by my colleague.
So hi everyone, my name is Katrakan Kamila with last register number 009. So I would like to state several research problems in this student project. So the first one is, what is the definition of CAD? And the second one, what is the method of journal searching for this student project? And the third, what is the cause of CAD? And the next, what is the definition of microminerals? And how do microminerals impact CAD? And the sixth, what is the absorption and the digestion of microminerals in CAD? And the seventh, what is the RDA? And then what is the possible risk related to microminerals consumption in CAD? And the last research problem is, what is the nutritional approach of microminerals in CAD? And there are also some of the objectives of the study. The first one is to know the definition of CAD, and the second is to know the method of journal searching for the student project, and the third to know the cause of CAD, and the next to know the definition of microminerals, the fifth to know how microminerals impact CAD, and the sixth to know the absorption and digestion of microminerals in CAD, and seventh to know the RDA, and the next to know the possible risk related to microminerals consumption in CAD, and then the last to know the nutritional approach of microminerals in CAD. So that's all from me. The next will be explained by my colleague. Thank you.
Okay, thank you for the time. My name is Inyoman Gede Satrasjana with last 3 digits of the number 011, and I'm going to explain about the benefits of the study. Next slide, please. Okay, thank you. The benefit of the student project is to amplify knowledge and understand of microminerals in patients with coronary artery disease, or CAD, especially regarding the urgency of the problem, definition of CAD and microminerals, etiology, microminerals and their metabolisms, RDA, possible risks related to micromineral consumptions, and nutritional approach in CAD patients. In addition, the student project is also expected to be a reference for other projects and research related to microminerals in patients with coronary artery disease, or CAD. I think that's all for me. Next will be continued by my colleague. Thank you.
My name is Aurelia Tapina Putri Wigianto, and the last 3 digit name is 081, and I will explain about the definition of CAD. Coronary artery disease refers to a progressive condition characterized by the development of an arteriosclerotic plaque in the coronary arteries, leading to partial or complete obstruction of blood flow. These plaques are primarily composed of lipid, cholesterol, inflammatory cells, and smooth muscle cells. Over time, they can cause the arterial wall to thicken and harden, resulting in a reduction of blood supply to the heart muscle. This compromised blood flow can lead to various clinical manifestations, including angina pectoris or chest pain, myocardial infarction, or heart attack and heart failure. That's all for me. Thank you.
Hello everyone, my name is Inyoman Mayana Putra. My last three number is 050. Today I will tell you about the etiology of CAD. So coronary artery disease, or CAD, is primarily attributed to atherosclerosis, a process characterized by the buildup of plaque within the coronary artery because of the accumulation of lipids, particularly low density lipoprotein or LDL, cholesterol within the arterial walls. Causing inflammations occurs as the immune system respond to the lipid deposition, leading to the recruitment of inflammatory cell like macrophages. This macrophage will engulf the lipids, forming a foam cell that will contribute to the formation of fatty streaks. Over time, smooth muscle cell migrate to the site, proliferate and produce cellular matrix, resulting in the formation of fibrous cap over the lipid core. This plaque becomes very unstable as the fibrous cap weakens, making it very likely to rupture or erosion. When a plaque rupture or erosion, platelet aggregate will come to the site and make a thrombus, potentially obstructing the blood flow through the coronary artery and leading to a CAD, such as heart attack or angina. That's all from me. Next.
Hello everyone, my name is Grace Veronica Wijaya with my three last digit of my student number 113. So now I will continue the presentation about method of journal searching. In writing this student project, the author used the literature review method for this paper. The author used the keyword CAD, coronary artery disease, heart disease, microminerals, and trace elements, as well as Boolean logic such as and or not. The author chose academic database such as PubMed, Google Scholar, or Science Direct to perform a data search. The data obtained are arranged systematically according to the topic discussed. That's all from me. Next slide will be presented by my colleague. Thank you.
Good morning, my name is Christine Edgar and my last digit of student number is 045. Next, I will present the definition of microminerals. Definition of microminerals. Minerals are naturally occurring solid consisting of various elements or chemical compounds. Minerals are divided into two, namely microminerals and macrominerals. Microminerals have an essential role for life and health even though they are only present in very small amount in the body. The type of microminerals needed by the body are iron, zinc, copper, iodine, manganese, molybdenum, and selenium. That's all from me. Thank you.
Allow me to introduce myself. My name is Carla Kenovling Manulang with my last three digits are 146. And now I am going to present about microminerals in CAD. So, imbalanced metabolism of zinc and copper is the risk factor for coronary artery disease or CAD. A significant association was found between serum copper, zinc, and several coronary risk factors that both copper and zinc status are important coronary risk determinant. The presence of copper deficiency leads to decreased copper-zinc superoxide dismutase activity, resulting in hypertension and increased accumulation of arterial lipid peroxide due to impaired endothelium-dependent arterial relaxation. Microminerals in patients with acute myocardial infarction in the form of decreased serum zinc and increased serum copper are associated with the level of myocardial damage. That's all for me. The next part will be continued by my colleague. Thank you.
Okay, hello everyone. My name is Siputu Diva Perlana Arta with three last digit name numbers 238. So I'll continue the presentation about the digestion and absorption of micromineral in CAD. Okay, so maintaining appropriate levels of microminerals is essential for cardiovascular health and overall well-being. So CAD patients should consider dietary strategies that promote optimal digestion and absorption of microminerals while accounting for potential interactions with medications or dietary restrictions. Further research is needed to explore specific interventions that can optimize micromineral status in the context of coronary artery disease, potentially improving patient outcomes and quality of life.
Hello everyone, my name is Evanya Rini Natali Pranoto with the last digits of student number 166, and I will explain about the recommended dietary allowance for microminerals. So the micromineral recommended dietary allowance is the average daily consumption level of microminerals required by society. The micromineral requirements of each individual vary according to gender, age, and clinical condition. The following is a table of daily mineral requirements according to the Ministry of Health of the Republic of Indonesia. So this is the recommended dietary allowance for infants and children and for males. And this is for females, pregnant women, and breastfeeding mother. Maybe that's all for me. The next slide will be presented by my friend. Thank you.
Hello, my name is Fauzan Azimamika Javani with the three last digit of my student number is 131. So, possible risks related to micro minerals consumption in CAD. Micro minerals are essential for human health. underconsumption can pose a risk of consume in excessive amounts of, or if deficiencies occur. If it's important to maintain a balanced intake of microminerals and consider individual requirements and potential risks associated with specific population or dietary patterns. The further research is needed to better understand the optimal intake levels and potential risks associated with micromineral consumption.
My name is Jen Susteja with the last three-digit name 080. I'm going to explain what nutrition approach. So results of a study has shown that zinc and iron intake has a negative correlation with stroke morbidity. Here we learned that the recommended dietary allowance of iron adults aged 19 to 50 years old is 8 milligrams for men, 8 milligrams for women, 27 milligrams in pregnancy, and 9 milligrams in lactating women. As for zinc, the daily RDA is 11 milligrams for men and pregnant women. For women who are not pregnant, it's 8 milligrams, and the lactating women, it's 12 milligrams. Foods that are rich in iron and zinc, for example, are meats, poultry, and seafood. Secondly, copper. Increased dietary copper intake has also shown to reduce risk of cardiovascular events, especially in elderly population, due to pathophysiological differences. As for the daily RDA, in adults it's 0.9 milligrams, in pregnancy and lactating women it's 1.3 milligrams, in children aged 14 to 18 years old it's 1 milligrams. As for other microminerals, it is important to maintain a healthy and balanced diet so that the body is not deprived of any of these micronutrients. The next part will be explained by my colleague. Thank you.
Hello, let me introduce myself. My name is Kalista Manurung with the last digit number 208. So the summary of microminerals in coronary artery disease. Micronutrients such as vitamins and minerals are crucial for human health, regulating brain function, immunity, pregnancy, and energy processing. Microminerals like iron, zinc, copper, iodine, manganese, molybdenum, and selenium are essential in small amounts. Copper and zinc play important roles in cell metabolism and enzyme function. With imbalanced metabolism bring a risk factor for coronary artery disease or CAD. Copper deficiency can lead to hypertension and increased arterial lipid peroxide accumulation, while zinc deficiency can affect blood pressure and glucose tolerance. Micromineral digestion and absorption, particularly a non-heme iron from plant-based food, are important for maintaining an appropriate levels. Disruption in absorption can occur in CAD, affecting iron levels. Dietary components like phytates and oxalates can hinder micromineral absorption, especially in restrictive diets or individuals with malabsorption issues related to CAD. The recommendation is a better understanding of micromineral in CAD is needed from the definition, absorption, and digestion of micromineral and the risk of micromineral disorders in CAD in order to later identify CAD disorder appropriately and seek literature reviews properly. That's all from B4 student project in micromineral in CAD. Thank you.